Dr. Jackson from Texas for 5 minutes of questions.
Thank you, Mr. Chairman. I appreciate it. And I want to thank all of our witnesses for being here today. Dr. Redfield, I want to thank you in particular for your service as CDC director. You were key in getting some of the meatpacking plants back up and running during the height of the pandemic in my district, and I appreciate that. I just want to say I agree with a few of the things that have been said on the other side of the aisle from my colleagues. And one of the things I want to talk about that hasn't really been addressed here from this side of the aisle is that, yes, I do believe that public health has been devastated by this COVID pandemic. But that is because public health officials in this country decided that they were going to consider the politics surrounding this issue when making statements and recommendations. That's the root of the problem with the public health here. And yes, this must be repaired. We have to get our public health industry back. The only way that that will change, is if that we can regain the trust and confidence that we have to have in this country in our public health sector, is to look back. Look back at what happened, who made what decisions, and why those decisions were made. And most importantly, if public health authorities, such as Anthony Fauci, betrayed the trust of the American people, they must be held accountable. Period. Somebody has to be held accountable. This is a problem we have in government, throughout government. If there's no accountability, nothing changes. We're going to be doomed to repeat this whole disastrous period in American history again if we don't get the answers about what happened and why it happened. In addition, I just want to say that this continues to this very day. The WHO, China, the mainstream media, social media, they all need to be called out. They need to be held accountable for their part in this cover-up. Millions of people died, and we need some answers to what's going on. And I'll say that we still have an issue with this today. We still have an issue with corrupt, politically driven advice, and this is evidenced by the misinformation regarding masks, natural immunity, the need for boosters, and most importantly, and most important to me at this particular time, the inappropriate efforts to vaccinate our children. So I would just say that we have to regain this trust in public health, and we have to do it quickly before something like this comes down the pike again, because American people right now have zero trust and confidence in the public health sector in this country. So I want to ask you real quickly, Dr. Metzel and Dr. Redfield, what do you think that we should and could do to regain that trust of our public health sector?
A number of things. First, we need to look objectively, honest, directly, fearlessly at the COVID origins issue. As I've said before, I think the primary culprit, if that's the right word, is China. But we also need to look at ourselves. We really need to look at everything. We need to follow the evidence. We also need to establish a bipartisan process for evaluating the entirety of our readiness, and that's why in my remarks I recommended establishing a bipartisan COVID-19 commission, kind of like built on the model of the 9/11 commission, because it's going to be very difficult to do it piecemeal. We really need comprehensively, in a bipartisan manner to develop an action plan, and because health is international, that means exactly as you've said, we need to focus on the national and the international levels.
Dr. Redfield, real quickly.
Yeah, real quick. I think the first and foremost is we've got to tell the truth. When you don't tell the truth, you've got a problem. And I think if you go back, there were many times when public health officials packaged the message to what they wanted to say, but it wasn't necessarily truthful. The second thing, you have to have the courage when you're a public health official to say, I don't know, when you don't know. And I think that really fundamental, that's how we begin to lose it. When people say that we're going to be okay once we get 30% immunity, and then later they say 50%, and then later they say 70%, and then the press says, well, why did you say 50% before, and now you're saying 70%, and the guy says, well, I didn't think the public was ready to hear that. You've got to tell the truth.
I want to get a little bit of time here. I want to say, how I said I did agree with some of the stuff that was being said on the opposite side of the aisle. One of the things I don't agree with, and I think that the way we have to fix this, is we do have to get past the politics now. It's over and it's done with. There's been a lot of damage done. We got to get past that. And I'm disturbed that the people on the left in this committee can't talk about this at all without bringing up Trump, racism, or conspiracy theorists. And I just want to clear the record on one particular thing. President Trump, on May 29th, 2020, recognizing the failures of WHO, severed the U.S. relationship with WHO, citing the need for serious reforms. And despite Despite this, despite no reforms taking place, on his first day in office, President Biden rejoined the WHO, which was and continues to be nothing more than a puppet of the Chinese government. I want to also say that on January 31st, 2020, President Trump came under intense criticism when he banned travel from China, an order then presidential candidate Biden called xenophobic, a move that even the highly respected Dr. Fauci on the other side of the aisle praised as saying that Trump's actions saved thousands and millions of lives. So thank you. With that, I yield back.